Guys, welcome back to Safety Sunday. So today we're going on to segment 2 of first aid. We'll be talking about common injuries that can happen to anybody at any time. It may not necessarily be the fault of anything. It could just be nature. So the first thing that we're going to talk about, as you can see from this picture, are nosebleeds. So for nosebleeds, first, of course, obtain consent from the patient to check them out, or from a parent if they're a minor. And then if they say that you can check them out, you want to do that secondary assessment that we learned about earlier. And then for nosebleed specifically, you're going to have the victim lean slightly forward and pinch their nose for 5 to 10 minutes. So you want to have them lean slightly forward. A lot of people think that you need to lean back, but actually that could cause them to choke or swallow their blood. So you want to have them lean slightly forward, pinch their nose for 5 to 10 minutes. If the bleeding stops in those 5 to 10 minutes, you can release them. Just advise them to not rub or scratch or pick their nose so they don't re-aggravate the bleeding. If the bleeding doesn't stop in 5 to 10 minutes, specifically like over 10 minutes, call EMS, just because it might be due to a larger issue that their nose isn't bleeding than just a common nosebleed. And then so they will get that extra medical attention once the EMS arrives. If the victim becomes unresponsive, you're going to want to perform a primary assessment now that they are unresponsive. If they are breathing, just put them on their side so that the blood drains out of their nose and it doesn't go into their throat or anything. And then if they become unresponsive but they are not breathing and they don't have a pulse, you're going to want to do CPR, make sure EMS is summoned right away. And that is what to do in the case of a nosebleed. Hopefully it's just a regular nosebleed and it's not that serious. The second thing we're going to be talking about is mouth injuries. So if it's a mouth injury, you don't suspect a head, neck, or spinal injury, and they aren't missing any teeth, just have them rinse their mouth with cold tap water, if that's available. If it's not, regular water will do. And then have the victim again lean slightly forward, or even place them on their side so that they don't swallow or vomit, so that they don't swallow their blood, which could cause them to vomit or something, or make them nauseous, because that's gross if you're swallowing their own blood. And then apply dressing. So just, if they bit their cheek or something, apply some sterile gauze back there. Now, if they lost a tooth, you want to do the same thing, more or less. You want to have them bite down on that gauze so that the sterile gauze is in their tooth, preventing bleeding from spreading or going further into their mouth, hopefully stopping it and clotting it a little bit. But then you want to try to find those displaced teeth. And you want to carefully pick it up by the crown, which is the white part of the tooth. Don't touch the root of it, because you are going to want to keep that root as healthy and alive as possible. And then you are going to place that tooth into something called Hank's balanced salt solution. If you don't have that, you want to put it in egg white, coconut water, whole milk, or even the victim's saliva as a last resort. And this will hopefully keep that tooth alive so that when the victim goes to any further medical attention, the dentist or something can hopefully put that tooth back in, and that nerve on that root can still be alive. And if that tooth was knocked out and it wasn't just a natural, a kid's tooth falling out or something, then advise them to go to an emergency department or a dentist with the tooth that you saved as soon as possible so that it can be put back in. It can be reimplanted within 30 to 60 minutes. If it goes after that, then they can't really do much. So that is a tooth or mouth injury. And then we have insect bites. So insect bites, bee stings, stuff like that. If you can see the stinger, try to remove it with a credit card. Don't try to pull it out. Don't yank it out. Remove it with that credit card. Just scrape it. And then once that happens and you get that stinger out, wash it with soap and water, the wound. Cover the site with a dressing to help keep the wound clean. Apply a cold pack to help reduce swelling, make the sting feel a little bit better. And then make sure that you're watching them and make sure that they're not allergic or anything to the insect bite so that they don't suffer any further consequences. So that is all for these minor injuries. Again, take the quiz that is down below. And thank you guys for tuning in. See ya. Bye. I don't know why I just threw up the peace sign. That was weird. But see you guys. Bye.